she was very much any child that would come to her home, she would just adore them, whether it was our neighbors or anything. In terms of early integration models of AI in the dental practice, so we're starting to see some of it trickle in more so from like a dental radiography perspective. Let's monitor till your next 6-month checkup. So you can make more informed decisions in partnership with your clinician as a patient. So it doesn't necessarily phase out the clinician.
Welcome to the second episode of the Entrepreneur and Career series. In this episode, we will see what real career transition is, not career progression as we know it. Like my career progressed out of necessity, or I took advantage of the gaps in the market. But this one is real. From a dentist to a corporate career as a principal scientist in one of the biggest companies in the world. Welcome, Dr. Anusuya, to this episode. Over to you, Rama.
We are excited to welcome you to the show, Anu, and we would like to definitely hear your entire journey, what you've been doing, and then we'll have a few questions that goes by. So please kick off by giving us a brief intro at your end.
Thank you so much for having me, and so nice to be on this platform. So my name is Anu Bhardwaj. I am a pediatric dentist and currently working at a large CPG firm in their medical affairs team as a principal scientist. So as far as my background, I was born in India. I was raised across Nepal, Singapore, Germany, and then moved to the US when I was a little bit less than 10. And I had always known that I wanted to be in healthcare. And so that sort of inspired me to study the sciences in college. And then I went to dental school at Case Western in Cleveland. When I was at Case Western, I really got interested in how our oral health outcomes impact our systemic well-being, and that these spaces are usually considered mutually exclusive, like in the US, because of insurance reasons and etc., where you tend to think of them as being separate. But in fact, there continues to be evolving evidence that we are actually, what you see in the mouth impacts what you have as an overall sort of well-being perspective. So I was curious to learn more about this and also dive deeper in the preventive care space, early diagnosis and intervention. And that's what really ultimately drove me to specialize in pediatric dentistry. And then after practicing for several years, I had reached a point where I grew more curious about wanting to make broader impact. And it was at that time that I decided to pivot and take on a role industry side, which is where I am currently. So look forward to having this conversation.
Great. So maybe we'll start at the first place just to tell us what is a pediatrician dentist, what they typically do, what you love about that field, and how is the day-to-day in a life in what you.
Before that, you said you knew that healthcare is the domain at a very young age. What triggered that? And then you can talk about your journey as a dentist.
Yeah, absolutely. So I think that I was fortunate to have been surrounded by clinicians and doctors who were very influential to me from an early stage. I always enjoyed going in for my checkups and seeing all the different devices that the doctors would use. I was always curious, but I was always apprehensive as a child at the same time. But internally, I saw how with kind of engaging with my dentist, with my pediatricians, I was able to overcome some of these fears, and I was able to grow more informed about this space. So personally, I was always curious about healthcare, medicine, what piece of that pie do I want to target in my life and take on? So that's kind of where it started. And then as I progressed through schooling, I really did fall in love with the sciences. So it felt like a natural fit to sort of dive deeper into this space a bit further. And that's what ultimately kind of spurred my interest in studying chemistry in college. And when I was in undergrad, I was thinking, okay, what field of healthcare do I want to go into? Do I want to go into medicine? Do I want to go into dentistry? In fact, dentistry was not even on the spectrum. I was actually thinking of being a psychologist for some time. And it was actually at a family dinner. We had someone over who was a dentist at the time, and she said, well, you're trying to figure out what you want to do, so why don't you come and shadow me for a day? I'm a dentist in town. So I decided to take that on as just a learning opportunity. And that curiosity ultimately, I think, sparked some interest. What drew me to dentistry was the opportunity to really partner with your patients on a lifelong journey. You're one of the few clinicians who actually works with patients. You see them multiple times throughout the year. You partner with them on the preventive care journey, and you really develop relationships. The dentist I shadowed had patients he had known for 30, 40 years, and he saw their children, and he was really an integral part of the community. So I thought, wow, that's pretty inspiring. I don't think I necessarily saw that in some of the other places I had at that time shadowed in. So I was curious to know more about it. So I took on some additional learning opportunities in the space, and then grew convinced enough that I decided to take it on as a profession. So that sort of is the journey to getting my interest geared towards the dental world. In terms of pediatric dentistry itself, so pediatric dentistry focuses on providing dental care for children. Now, depending on the practice, it can be geared to kids 0 to 12, or some instances it's like 0 to 21 because of insurance reasons. The focus of care is usually around preventive care, developing early trust and education on oral health. So you really partner with parents, because one of the things that I think we can all resonate with at some point in our life is that we've come across folks who have a lot of apprehension about going to see the dentist. In fact, sometimes we even avoid it, whether it's access to care, our own sort of psychological apprehensions. So when you have like that exposure early on, and it helps you normalize it and makes you feel comfortable in the dental office environment, then that kind of sets you up for a lifetime of positive oral health well-being. And it's that positive oral health outcomes that has a vital role in ultimately impacting your overall systemic health as well, because ultimately these spaces continue to be connected. So we want to make sure that we impact healthcare in our own sort of perspectives. So pediatric dentistry focuses more on preventive care and then early diagnosis and intervention. Care in the office can be, in terms of just providing care with behavior management, and it can also go into more like providing anesthesia for children who have a lot of treatment and certain apprehensions. So the big takeaway from this profession is that you have to not only love working with children, but you have to love working with adults, actually, more in the sense that you have to partner with their parents on this journey and be sort of the educator and informer in many situations.
One thing we've seen from your personal experience is getting the kids to brush at home is almost impossible. But when they visit the dentist, they are like so understanding, and the dentist says that, oh, you have the best kids in the world. So I think you have a knack of just making sure that just kids fall in place, and the art of just convincing them to do the right thing, which is just amazing. See, one thing I saw is just the love of working with children and the ability to sort of love the sciences and make an impact on the community and being driven from it. So, and I think what Priyesh asked, how did you develop the sense? I mean, when did you know at which point that you love this and you decided that I'm going to double click on it? You mentioned about doing chemistry in your bachelor's and then at some point thinking about psychology and dentistry. But what else helped to make that decision would be interesting to understand.
Yeah, so As far as loving working with kids, so my mom was a teacher, so I kind of had this, and she always loved being around children, and she was very much any child that would come to her home, she would just adore them, whether it was our neighbors or anything. So it was something that I had taken on very much so from an early stage. So I was curious, even if when I was thinking about, if I want to practice medicine, I was always thinking I would be a pediatrician. So it was always a question of doing something in the pediatric world. And then as I sort of went through my my learnings, I enjoyed the sciences. What I guess one of the things that kept me curious about wanting to better understand the basic sciences was really as I transitioned to as a clinician, seeing how, for example, medications or dental materials or devices can have such an impact on delivering healthcare and driving outcomes. So understanding how the basic sciences integrate into overall healthcare delivery at a more high level from like that end-to-end perspective was one of the things that I think kept me curious and interested.
I have two questions now. Okay, one is many of our viewers may not know how overall healthcare, is important to the systematic healthcare. One, second, as you know, I had a stroke in 2008. When I went to the dentist after my stroke, he said the teeth is not the cause for the clot or the thrombus in the blood. So it was interesting that, and it was the first time I heard a dentist say the teeth is not the cause for a stroke. Okay. So, one, how is oral healthcare vital? And two, how the teeth or the oral thingy can affect you or cause a clot in your bloodstream?
I think it's beginning to rain. I will step in.
So it's a great question. I think the overall red thread in both of the questions is the connection of, is oral health directly tied to systemic health and systemic health, disease state outcomes, and well-being, etc. I think that this space is very interesting. There's a lot of research and development, especially from what we've seen in the past decade or so, that's happening in this space. In terms of a direct line from your oral health outcomes to your systemic health outcomes, it's a little bit challenging to draw. Yes, you can connect potentially certain factors like maybe inflammatory factors in the mouth to how they can impact your systemic health, or maybe from a microbiome perspective, there are certain correlations, the bacteria in your mouth to the bacteria in our body, or stressors in your mouth to the stressors that happen. But it's a space that I think, in terms of having like a very clear, because of this oral health outcome, we are either at an increased risk for X or at an increased, or will end up having this sort of systemic condition. It's not necessarily articulated in any of the guidelines. So I think that it's a space that is evolving, and we're trying to better understand it, because from a preventive care perspective, we want to provide a more holistic picture, because I think traditionally the way industry has provided oral health education, educational, universities have provided oral health education, is more, in a traditional perspective, was more just focused on oral health. But really helping understand how we can connect it is part of educating clinicians so that they can make oral health more relevant to everyday patients and consumers. So that's a space that I think is continuing to get evolved with time, and we're learning more about how, for example, oral health can have an impact on diabetes and what that link looks like. But we still need to better understand the directionality, if it's bidirectional, etc. So, but it's definitely a space that we're seeing increased abilities to draw connections between conditions like diabetes, cardiovascular disease, etc. In terms of why is oral health relevant? So oral health is relevant for several other reasons in terms of functionality, aesthetics, being able to eat, drink, and being able to live without pain. One of the most painful experiences we can have when you look at, the pain spectrum of experiences we can go through in our life, like, having a baby, etc. Tooth pain is actually up on that list, pretty high up. So knowing how we can mitigate dental pain is not just helpful from an individual perspective, but there's a cascade of events that happens when we don't care for our oral health. So if we avoid oral health preventive care at an early stage, then that develops into a state of disease. If we continue to avoid caring for that state of disease, that can evolve into pain or sort of more acute conditions. If we continue to disregard that, that can evolve into, say, swelling or more, and then that can spread into more systemic. And then that eventually patients then find themselves in certain situations going into the emergency room for dental pain. So that's where you kind of see this bottleneck, because in the ER you also have a lot of other patients who are coming for other conditions. And there's only so many healthcare providers at any given time. And specifically, the oral health education on the medicine side continues to be a space that needs to be better evolved. So patients who come into the emergency room are often treated from an oral health perspective, more likely for their symptoms, right? So whether it's antibiotics or pain medication. But in terms of actually going back to the root cause of the fact that this was largely, most likely preventable, is typically not addressed in that moment, because it's a moment of like, there's just too much going on.
Yeah.
So there's a cascade of events that happens, but it ultimately starts with kind of building out that big picture so that we can understand that there's value in spending those 2 minutes brushing our teeth well, because if that doesn't happen, then there's this series of events that we ultimately find ourselves stuck in.
Got it. So which means that I should take my dentist thing seriously from here on, because I don't floss regularly, and that's something that I sort of hate. So one thing I was thinking, right, almost like a movie, I want to go back in time, right, the flashback. You mentioned that you spent time in India, you grew up a little bit in Nepal, and then you in Germany, and then eventually to the US. So I want to understand how that helped you growing up as a kid, were there any challenges in general? And the second thing is your point of view of looking at the healthcare systems in these various countries. What do you think that they should be doing better, or opportunities? So two of them would be great.
Yeah.
Get your perspective.
Before Anu can answer, she is given every man the chance to say, I have a tooth pain, which is as higher in the pain category as you delivering a baby.
Baby. Yeah. Yes. Yeah.
Yeah, absolutely. So I think it's growing up across several different countries. It has enabled me from an early stage to have an appreciation for people of different backgrounds, people of different cultures, and learning the ability to just be agile, whether it's learning to adapt to new educational systems, new healthcare systems, developing new friendships. And so as a part of that journey and in my path towards moving into healthcare, I have often reflected back on the countries that I've lived in and the kind of healthcare that I personally received in the process. So being exposed, for example, in Singapore and Germany to a more socialized way of healthcare, and seeing how it enabled all citizens to have equal access to the opportunity to achieve health, and the intrinsic motivations that in certain areas that you would actually be motivated to go see your healthcare provider, whether it's for preventive care, vaccinations, routine visits, or for actually having like a pipeline for figuring out if you have a certain health disease or health condition, how you can actually access care. So I thought that was an interesting experience. And of course, in the US, We have more of an insurance-based model. So it was something that was actually quite confusing, I think, when we initially kind of got going in terms of figuring out, okay, we have this specific model of insurance, which means we can access these set of providers. And then it was also a unique experience now on the other side as a provider to then be able to say, okay, what insurances do I want to accept and what factors go into that process, right? And one of the things that's interesting is that we're seeing there's this transition in healthcare. So you have your hospitals and then you also have private offices. With private offices, they're getting increasingly sort of tied with larger conglomerates, whether medical groups or dental groups, which are owned by, say, a private equity fund, etc. Because the cost of running the business for a private practice and the profitability margins, etc., can grow increasingly tighter with time. So when you tie yourself up as an individual practice with a broader set of offices from like a procurement perspective, insurance negotiation perspective, you tend to have a little bit more leverage because you're seeing far more volumes of patients. So as a practitioner, it was interesting to see this on the inside because it helped me build an appreciation for, okay, so as a patient, I can access these providers, but on the other side of the lens, providers have to take into consideration, this is from like a very basic perspective, these are sort of my overhead costs of running the practice. So these are the insurance fees that I would be able to accept in order to provide care for patients, or how can I work with insurances to get to a point that I can negotiate so that it can still be amenable to my business and practice. And for some practices, they might just not be able to do it on a standalone basis. And that's where working with a larger group might be a reason to consider for transitioning. So it's been a really interesting journey to, I think, get exposed to different ways of working across healthcare systems and then living into it as a patient and, of course, now as a practitioner.
I think in Germany also it is changing a bit because private specialty like physios or rehab or whatever, they try to take in more private insurance, health insurance patients first, then the public insurance patients. But overall, 90% of the times, as you said, it's a social structure. Everybody has to have, health insurance, and more or less, the system is very good, oiled and running. But we need more doctors. So I had a question in terms of you said you shadowed a dentist. Did you shadow out of your own interest, or the education system allows students to do whatever they deem fit for them to pursue a career? Because in Germany, when you're 13 to 16, I have seen students who shadow my speech therapist or my physio or my GP or whatever, for them to choose. And then when they get into college, they have to shadow this specialist before they can take the final exam.
So yeah, it's a very interesting question. I think from a US perspective, from what I've seen, I don't necessarily think it's as formalized as in you have to shadow ex-clinicians or go through a certain runway in order to get into medical school or dental school. I think that it's a bit more fluid, but generally there tend to be certain milestones that you go through in the process of figuring out if you might be interested in it. And one of those is shadowing a clinician. The other piece is, if you're interested in the sciences, have you taken challenging scientific courses and done well in them as part of your training? And there's other pieces like, have you volunteered, done something in the healthcare sort of arena? So there's different ways in which you can approach it to get the experience, but shadowing is one opportunity, and it's something that I think is most of the folks who, at least I know personally, who are practicing medicine or dentistry have shadowed a clinician at some point in their journey. In terms of like how the shadowing is structured, it's pretty much up to the clinician that you are observing, and what you get out of it is, of course, also what ultimately you put into it, in the sense that some folks will actually develop a relationship with the clinician they're shadowing, and then that becomes a mentorship, so that as they're going through their educational journey, they continue to it's like a process that they continue to loop back in with them. So, but it's definitely not as formalized.
So I had one question. So when I go to the dental practice place, there are nurses, and then anytime when somebody needs to do a surgery, I get a specialist who does that, right? So within the actual dental space, what are like the hierarchy or the different roles that people take, and career opportunities for students?
Yeah, definitely. So there's several, as with all fields of healthcare, there's definitely, I think, a spectrum, and the practice as a dentist in the dental world is just one piece of the puzzle. There's different things that you can do in a dental office. So, when you walk into a practice, you have the front desk. So the front desk is responsible for everything from calling patients, registering new patients, verifying their insurance, managing sort of the everyday flow of care. So sometimes you'll walk in and you'll have, say, 40 patients that are scheduled that day. And then the way that treatment and recall appointments or preventive care appointments are scheduled is based on columns. So our practices typically have one assistant in the back, which we'll get to in a moment, who handles every column. So sometimes an assistant calls out sick. So the front office is really responsible for figuring out, okay, we still have X number of patients that we need to see. How are we going to stagger the schedules? Is this person confirmed? Can we move this person down? So really sort of like crisis project managing the front desk, if you will. So that's the responsibility of the front desk. Now, in the back office, you have several different folks who help. So you have your dental assistants. So dental assistants are usually the folks who will sit with you chairside during a dental procedure. They'll set up the room, break down the room, provide post-operative instructions to patients. They will sit with patients throughout the time of their care while the dentist is going in and out between numbing and seeing other patients, etc. And they'll hand instruments to you, and they're an integral part of usually the operative side of care in providing chairside assistance. Registered dental hygienists. Hygienists are sort of the specialists of preventive care, in my perspective. They go through a 2-year program on average that enables them to be an RDH, registered dental hygienist, and their focus is on providing preventive care education, preventive care services like cleanings, deep cleanings. Depending on the licensure requirements of certain states, they can actually provide numbing in certain area. And they are really one of the main reasons that patients really like coming back to practices, because you spend way more time with your hygienists, sitting chairside, getting your cleaning done, talking to them, telling them about your life, than you do at the doctor or the front desk, etc. So it's very important to have that team member, because they will be running a large portion of your practice, which is on the preventive side. The dentist themselves, so the dentist does a lot more of overall sort of ensuring that the partnering with their practice manager. So the dentist provides sort of overall operational management in partnership with this practice manager role. So the practice manager will oversee all of the functions of the practice, making sure if there's, any procurement concerns, or making sure everything is ordered on time. If someone's out of the office running behind, patient needs extra time, they'll make sure that everything is just kind of running as needed, keeping the dentist looped in where we might need to make adjustments. the dentist themselves is focused on, providing patient care from the perspective of when you have new patients, reviewing their history, diagnosis, developing a treatment plan, any sort of surgical treatment or restorative care. It will be obviously executed by them. Ultimately, I think the face of the practice themselves is the dentist. So ensuring that they develop those relationships both in the practice, but also going outside of the office in terms of engaging with the community across different platforms, or engaging with the local national dental association so that they can represent their office and continue to get educated and bring in the best care for their patients and upskill their staff in additional procedures. So definitely a multi-pronged sort of ways of working. And one of the newer spaces that's evolving is an expanded function dental assistant, where you are sort of between the dental assistant and hygienist in the scheme of things. So the EFTA, the expanded function dental assistant, is able to sort of support with additional responsibilities on the restorative care side.
So last question on this career before we pivot. Rama and I are super interested in AI. We talk about AI every day. Okay. So how was AI changing dentistry, and what should we look at in the future in this space? And will it take away your job as a dentist?
Great question. It's as far as the latter part of the question, I think it's still to be determined. But I think that in terms of early integration models of AI in the dental practice, so we're starting to see some of it trickle in more so from like a dental radiography perspective. So as we know, as I'm sure we all have felt at some point, we all the challenge with dentistry at some level is that we think of dentists as sort of this, they're clinicians, but we can also have a little bit of distrust because of the way the payment model is set up, right? Oh, this dentist, he said, you need X fillings. That guy said Y fillings. He's trying to upcharge you, and etc. And a part of it is also because there's a lot of variance in the way dental education is taught and is ultimately executed, and there's a lot of subjectivity in terms of how you can interpret the guidelines and approach patient care. So it creates a kind of this very nebulous space as far as like from a patient care perspective. So one of the early introductions of AI in dental care is the integration of the technology into reviewing dental x-rays. So if you've ever had a dental x-ray before, generally you can see the outline of your tooth, maybe the bone, and then maybe you can see a couple of dark shadows that your dentist might say, oh, that's a cavity, that's going into the nerve, etc. But it's really hard to understand, especially depending on the contrast and the granularity of the x-ray. As a patient, when you're looking at it, it's hard to understand, like, is this guy actually being real? Is he making sense out of this? Is this actually the right recommendation? So the AI technologies that are being developed, the goal is to basically provide an unbiased second opinion perspective on the radiograph that you've taken. So depending on the platform that's used, and it's still being developed, it can highlight, for example, if there are early signs of bone loss or early signs of decay or true signs of decay in different colors with different ways of demonstrating it. So that way, when you take a look at your x-rays, you can see your original images, a bunch of black, white, gray, and then you can see sort of this AI dictated image. And when you look at that and your dentist goes over it, you can feel like, okay, well, this, system is providing insight into, these spaces that might need care. And as you look at a few of your images, you might be able to say, okay, well, this looks consistent. This little orange spot maybe is into the enamel, and he's saying that these are smaller carious lesions. And given I otherwise have good oral health at this point, maybe the recommendation is let's monitor till your next 6-month checkup. So you can make more informed decisions in partnership with your clinician as a patient. So it doesn't necessarily phase out the clinician at this stage, but it does provide, I think, an increased opportunity for having more veracity from like a patient perspective, just a more truthful discussion with their clinician, and building more trust in that relationship. From a clinician perspective, I think it also helps just because the way a dental practice is run from a dentist side, you had asked about day-to-day from in the previous question. So the way from a dentist perspective is, okay, you're sitting down, you have your patient in the chair, you're numbing them, then you get told in your ear, okay, X patient is ready for their exams in the hygiene section. So you run over, you have your assistant with your patient in the operative chair, you run over, you're doing your hygiene checks, you have maybe, a minute or two to really, on average, maybe to look through your dental x-rays. You have to quickly develop diagnosis. If it's a new patient, you have to develop rapport with the patient, take a look at everything that's happening in the oral cavity, compare, contrast it with the x-rays, develop a treatment plan, present it to the patient, get their buy-in so they can go to the front desk and schedule their next visit, and off you go back to doing your treatment. So a lot happens, and you're with your preventive care patient for maybe 5 to 7 minutes, depending on the flow of the day and the kind of dentistry that you do, etc. But you're not with them for a lot of time. And one of the critical pieces of that time that you're with your patient is the diagnosis and treatment planning. So, and one of the critical components in that process is the diagnosis from x-rays. So having sort of this added support in that space is valuable, because ultimately we as humans are fallible, right? So yes, you are a dentist and maybe you have X years of experience, but we could still miss things, and that happens. And so this allows for, I think, an added sort of form of support for practitioners.
Okay, you said one last question, which we never listened to rules. I have one more question, right? And a comment.
As a patient, do I have access to that AI now, or it is only for dentist, so that I can put my x-rays into that system and see whether Rama is a fake or is not a fake, is
Real teeth or not?
Huh?
Real teeth or not?
ಇಲ್ಲ. Is saying I have to do this, and this, and you say this is only needed, and then I can choose between Anu and Rama based on the AI's input.
Yeah, a great question. I don't think that there is a patient-facing model at this time. I think right now the AI technology, it's still very early stage, but the way it's being integrated is into the dental practice software. So when they take your x-ray, by the time the x-ray is loaded, so the x-ray room is in the front of the office and the doctor room in the back. So by the time the x-ray pops up in the doctor's room, it'll have the sort of AI technology that overlays its recommendation on top of the original x-ray. And the way that it's done is, because this is still so early stage, that sometimes you have artifacts or random recommendations. So the doctor in the back can go ahead and just delete, saying, hey, this is not actually relevant. This is not real bone loss. I don't necessarily think this is true. He missed this. So it's still a system that's being developed. So I think in terms of rolling out to patients, it would need to be maybe a little bit more evolved, because then you kind of get into the space of indirectly maybe making recommendations on healthcare, that it would just need to be, I think, more refined before we maybe get into that space. So still very much in the early stages of integration. And right now the focus is on dental practice x-ray integration.
Maybe we can call it teeth GPT.
Yeah, teeth GPT. See, I was thinking you're probably starting a topic where we can probably discuss this for the next 7 hours, which we don't have. But I do want to touch on this though, right? We are in the era of co-pilots, and we know that AI is being like a horizontal technology. It has impact both on the clinician side of helping them through the process, and also on the patient side, where on a regular basis keeping them in check for them to know if they should really go to the the clinic right away, or they can wait for a few days. So there's going to be a lot of impact. So then I have one question, but before that I have a comment. Why do dentists ask all these questions after they put something in my mouth that I can't even answer? I don't know that.
It's a good
Anyways,
question.
That is a rapport building. I don't know how.
yeah. Anyway, my question is this, right? Probably this is before you want to do the segue. So one thing that happens is most when we go to do our bachelor's or our master's, we become experts in a specific field. So you learned about how to be a great dentist. But many more so often when you come out of dental school, you got to start your own practice, run your business. So what would you recommend or touch on certain people to learn those business skills in dental school?
Yeah, I think it's such a great question because it highlights that, when you go through dental school is very much focused on the mechanical care of it, right? Like, how do you diagnose? These are how you do fillings, how you do root canals, how you do treatment. But in fact, the real world, if you're running a practice, the time spent doing care versus all of the other administrative practice running things that keep the wheels turning, patient care and execution of care is just like a very, very small percent of your day. Right now, I think that a way a lot of dentists learn is by partnering. So early on in your career, you tend to, if you want to go the private practice route, they will either associate with a more senior dentist to try to learn the ways of working. So it's very much like inherited knowledge that you happen to gain, and then attending continuing education courses that we would do on the evenings or on the weekends to learn about, okay, how do you run a practice? How do you, how do you manage insurance, etc. It was very interesting because I was speaking with the leadership of an insurance company recently, and they were saying that they're just starting to educate dentists on, hey, you're going to do all this great work. Maybe you're an expert at doing a filling. Now, that filling is going to last for 40 years, but let me teach you how you're going to get paid for it. So I think that this is a space that right now in the dental education world, there's maybe an opportunity for providing education to clinicians to create them to be not just really great executional dentists, because that part is, at the end of the day, as a patient, all you want is your tooth to not pain and to be functional and maybe look decent, right? And good. But from a practice perspective, how to take a practice from zero or from wherever you get it, bring it to profitability, manage the different aspects of the business, continue to grow it, maybe expand the business. So I think this is a space that there's very limited, if not any, like really formalized education. It's a lot of like, you learn a little bit from a senior doctor, then maybe some of the folks who are ahead of you in your training, you go to some continuing education, and then it's a little bit of a sink or swim situation once you get your practice itself. So there exists an opportunity, I think, for partnering with dentists, because they're a very unique place in healthcare, unlike medicine, where sometimes you have more red tape with hospitals and insurance systems. With dentistry, the majority of practices are, at this point, still more so on the private practice side. Over time, maybe that'll shift a little bit more to these conglomerates. But fundamentally, any aspect, whether you own that practice or you're running it like you own it, even though it's part of the dental corporate, still requires very similar skill sets. So that upskilling from like being a very technically focused dentist to understanding the business, the strategy, how do you engage this practice with other practices, is a space that needs to be developed. I will add that, one of the things that I learned, for example, in this sort of sink or swim situation is I had the opportunity to start off a practice as part of one of these dental conglomerates. It started it from, I was told it was a startup practice, and when they say that word, they mean that word. I walked in day one, 0 patients, $0 in revenue, right? And my front office, I had one front office member, one back office. I think my back office staff member at the time was like on her last leg. She was like, I just needed a job. And my front office person, I think, used to do manicure stuff or something. So really needing to take that team and upskill them, because we had a $1.5 million something investment in this practice. So bringing it into the green, it was a time post-COVID, there was a lot of trepidation about going to the dental office, especially bringing your children to a dental office. So it was really like a learning experience for me in terms of like, I was purely focused on providing great care, providing great patient care, ensuring that we had positive clinical outcomes, but really pivoting to understand, okay, there's a bigger picture. So one of the things that helped me was, it was part of a corporation, so I was able to drive around to some of the other offices, see some of the practices that had started from zero and had done well, talked to those teams like across all the functions that we were talking about. So that's something that helps. But I mean, I think that it is an opportunity space in terms of really helping dentists understand so they can make more well-informed decisions, and really working in partnership with some of these other spaces like with insurance companies, etc. So we can teach dentists to do, yes, great work, but also how to get paid for it and how to run the business behind it.
Okay.
And before we just transition, one thing I want to say is deep respect for all the healthcare professionals that they did. People might have forgotten COVID, but those times were challenging times where they put their lives on the line. So kudos to you all for saving the community and keeping things in line.
Dentist, I'm sitting in this office providing care, but ultimately all of the products I'm recommending, the materials I'm using to provide care, the devices I'm using are a product of translational research. I wanted to take on a role that was more upstream in innovation and developing products that were driving broad impact.